Hi, my name is Dr. Antonia O'Planick. I'm a clinical health psychologist. I've been in the mental health field for about 10 years. That's been in medical settings, inpatient, psych settings, private practice, and now here at I'm Health too. I mean, it's an awesome job. It's a hard job, right? You're in the trenches with people, doing things that are really hard, working with people when they're experiencing some of the hardest things they've ever experienced, for sure. And it's really rewarding, right? To be able to work with people and to help people make some pretty serious changes and pretty quick changes in even a short amount of time. As a health psychologist, I love working on the overlap between health medical issues and psychological things that are happening. So that's why working in this environment in an actual medical, medical setting is super ideal for me to be already here. Usually when people are having some kind of mental health concern or some kind of behavioral health problem, whatever we want to call it, they usually go to see their doctor first. So that's where they're bringing up concerns about sleep or concerns about anxiety or ongoing depression. So it's ideal for me to be in this situation or be in this environment too, where I'm already here, to see if we can work on the overlap together. Some people will come for really targeted reasons. They want to reduce anxious thinking, they want to improve their sleep, they want to just be happier. So those tend to be more targeted treatment plans. We'll lay out the things that we want to do that specifically will address those things. Other people come in with a little bit more of a vague question, maybe like a suspicion that they could feel more at ease, or they could be happier, or they could be sleeping better. And that's where maybe, there's something that needs to be worked through, whether it's going through a rough period of life or maybe something that happened to someone in their past that needs to be addressed. But I don't know, I find most times people know what they have to do, they just need the right environment to do it in and the right support. So it's pretty structured. I mean, the first time I meet with someone, there's always kind of an intake session where we'll go over the background of the problem, gather the data that needs to be gathered, and then by session 2, I'm showing you a treatment plan, a written document that says, here's what I think that we should work on, these are the problems that you're having, and these are the suggestions to how are we going to get to some kind of resolution the best way possible. Three things: more short-term treatment, which is really targeted to, hey, let's work on this specific problem. More long-term treatment, like I said, is a little bit more, I don't know what I want to work on, but I want to talk about something. And then the third thing would be those assessments. So if people are having questions about, what is this thing that's happening to me? Do I have ADHD? It's also helpful for me to come in and ask the right questions so that I can also work with their medical team on questions about medication or treatments and make that a little bit more effective. In this job, relationship is probably the most important thing. It makes the difference between seeing a great therapist or just reading a self-help book or listening to a podcast. The way people make the best and most amount of change is meeting with someone that they can trust and someone that they feel comfortable with, which again is such a great benefit to being here in a building that people already know and relationships with people that they already trust.